What up, fam? Bose, and let's talk about my finals, because my finals coming up, and I am reviewing, and I've been reading this book like literally non-stop, to the point my textbook is falling apart. Going to be postpartum stuff that's going to be emphasized, and if you are using this text, you might go a little bit crazy. Postpartum, the changes with the body. One, it's going to be the Fundus. It's going to be like 1 inch per day. You want it to be firm, you don't want it to be soft and boggy. You're at risk for hemorrhaging. Like boggy, off, just associate that with hemorrhaging. They're like, yo, Akami, I don't know if I'm pronouncing it right. That means your ish is soft and boggy, and you don't want that because you want it to be firm. It should be midline, it should be in the middle, not on the side. Because if it's on the side, that means you need to take a wizard. You know, there's a bladder. The bladder is full. It's going to move it to the side. We mean that mama needs to take a wizard. So if you got a questions that's asking, you be like, yo, the mother popped out of nowhere, firm, extended, and it's deviated to the side. One of the questions is going to be massage. One of them is going to most likely tell them to avoid. Go with the void. Do not massage. That's a no-go, bro. When you're assessing it, just know that one hand's going to be on top and the other one's going to be above the super beginning last coming out, or just know it's going to be Lochia. Now the changes over the bleeding is going to be changes, just know that. There's going to be 3 changes, 3 different characteristics. The rubra, which is going to be bright red. Serosa, which is going to be brownish. Pinkish brownish. Alba, which is white or light brown. Time frames, and you have to know the time frame that you need to know. Yo, is there bleeding there? Like everything good or whatever? Find out what's going on. 3 to 4 days, bright red. They're gonna be bleeding, bro. Like a baby just came out. What do you think? 3 to 10 days, pinkish brownish because it's starting to heal up. 10 to 14 days, white, light brown because they're closing up, it's healing, everything's good to go. If it goes light brown, then it goes to rubra, be like, yo, fam, I need to call the doctor because there's bleeding up in there. I mean, cervix is not going to be the same. The appearance of a cervix is going to be different. Like the opening is going to be different. Just you get a question that goes, be like, yo, who needs further education on the student? Be like, yo, the student that says is gonna go back to normal appearance. Be like, nah, fam, it's not. It's going to look different. If you read into it, you're gonna be like, yo, what are you talking about, bro? Elevated temperature within 24 hours, it's good to go. And most likely the mother is dehydrated and stuff like that. Blood coming out, you're sweating, all this and that. Let's say if the temperature after 24 hours is like 100.4, that's a no-go. That basically means there's a sign of an infection. That's mad blood. Like I was there for my wife's delivery, my friend, bro, it was wild. They're gonna be losing mad blood, so the blood pressure is going to be low. Heart rate is going to be low because they lost mad blood, mad volume. The heart rate is past 100, be like, yo, I need to call the doctor because remember, brady okay, tacky no go. For clotting wise, they're gonna be at risk for clot. There's bleeding involved, there's healing involved. WBC elevated, going to be normal past like delivery and stuff like that, as long as there's no sign or symptoms of infection. If they said no odor, bleeding eye, like it's healing, blah blah blah, WBC elevated, how you would interpret it is your output is important, that you want them to pee. The max is going to be 3,000. The reason why you want them to pee is because a full bladder fundus is going to be deviated to the side, and that's not good. Important thing, they gotta pizzazz. For the skin, they're gonna be sweating. Oh snap, the lights turned off. Now for sweating, they're going to be sweating. That's actually expected. There's going to be hormone changes. 2 players that's going to be there is going to be prolactin and oxytocin. Oxytocin, when you think of oxytocin, it's going to eject milk. Prolactin help continue. Now breastfeeding is C to start, finger to stop. When you're holding the boobies, it's going to be on a C and to latch. To stop it, use a finger to. You don't want to just pull them away. Like babies, especially when they're in the vibes, they're going to be sucking. Be at risk for cracking and stuff like that. You don't want that. So you're going to use a finger to actually break the suction. There's going to be a situation where the breast is going to be engorged. Yo, you want them to breastfeed even if they're engorged, even if they're not breastfeed. You want to empty it. The last thing you want is let it be engorged and let it like build up, because it's gonna get hard, it's gonna get full, it's gonna hurt. Even if you're not breastfeeding, you want to empty it out. With engorgement, just know that everything that you do to relieve engorgement when you're stopping breastfeeding, it's going to be the opposite. You put warm compress for female that wants to suppress their milk production. You're going to put cold compress, warm cavity sleeve when it deals with engorgement. Cold cavity if you're trying to suppress it. Suppress as in she's trying to stop. Be like, yo, I'm cold compress, engorge and stuff like that. When you're taking a hot shower, you want the water to in front of you, stimulate the nip, get it popping. Now if you're trying to stop, you're gonna let the water hit you on your back, not from the front, because you don't want the nippies to be stimulated and be like, yo, I guess we're gonna continue making milk. You don't want that. There's going to be like 3 phases. Taking it in, mom is dumb tired. We're like, yo, mom just delivered the baby, bro. That's a legit human being. Mom mom wants to sleep, mom wants to rest. Taking hold, mom's trying to have control. Letting go is basically mom's like, yo, I'm a mom now. Gotta do what I gotta do. Like, oh, bubble, bro, like bubble is important. Breast, uterus, bladder, bowel, and Lochia. Epidural spot or the epi, like where the laceration and stuff like that, right? Breast, the nipples crack. Is there mastitis? Is there like engorgement, painful or whatever? Is everything good? Like that, right? Uterus is basically like, yo, how is the fundus? Is the fundus good? Is the fundus soft? Is there a risk for hemorrhaging and stuff like that? You want it to be firm, you want it to be descending. You don't want it to be boggy. You don't want it to be soft. If it's soft, you're going to massage. If it's deviating, you're gonna tell the mom, be like, yo, take over that. The fundus should be aligned, it should be midline, it should be descending at least 1 inch per day. Trying to be like, yo, is the bladder good? Is the mother's like peeing, stuff like that. Full bladder will mess up the uterus, and so you want to make sure that they're peeing. They will bowel. Are they going to be constipated? Yeah, that's a common thing. I mean, I don't want them to be constipated. Who wants to be constipated? Especially mothers. Yo, can you imagine you just delivered a legit baby and then after you're gonna make them constipated? Yo, look, you wrong for that. So they're gonna be stool softeners and stuff like that. Lochia, you know, the bleeding part, like rubra, serosa, and alba. Is it going in that order? Is it within the time frame? Then it went from alba, then after it went to rubra. If it's like that, be like, yo, I need to call the doctor ASAP because of the fact that most likely this woman is bleeding. Well, the woman is bleeding. It go from like healing to a bleeding heart. Nah, that's no good. If you follow my YouTube from back in the days, just know that I am not good with pronouncing stuff. Epithetomy, where like, you know, there's a laceration between the vajaj and the boob. You be like, yo, is things good? Is it healing? Now this actually showed up, and it's good that we like I actually highlighted on this part. Going to be degrees of laceration. That's one thing to know. First degree is superficial. Second is going to be the peri. Third is going to be the anal. Fourth is going to be the wall. That's kind of wild. Bonding stuff is important. Hot and cold. Just know that when it comes down to cold compression, it's going to be a rotation. It's going to be 20 to 10. 20 minutes, 10-minute break. 20 minutes, 10-minute break. You don't want it to be like full on cold all the time. That's no good. Kegels. Kegels is one of the most important exercises that you need to tell mom and be like, yo, do that, bro. It's important. Facts. Don't contract your abdominal. Don't contract your thigh. Don't contract your leg. Don't contract your buttocks, muscles. Get down there. So the naughty. No naughty after 6 weeks. Dad's gonna be like, yo, what's up? You're gonna be like, nah, fam, 6 weeks. Because I just push your baby. You need to wait. So 6 weeks is the break. No naughty after 6 weeks. Now for breastfeeding, just breastfeeding is the best, especially for babies and stuff like that. Legit, it's like evidence-based. It's colostrum is key, liquid gold. But there's certain times when you can and you cannot. Drugs, hardcore drug, narcotics, no. Mom has HIV and it's not take the medication stuff, nah. Mama has herpes, no. I think that's common sense. You don't want mom to breastfeed like baby when there's like herpes on her nips. No. Now, TB, varicella infection, nah. But when it comes down to NCLEX stuff, most likely they're going to ask questions about the HIV. But like, yo, can the HIV mom can breastfeed? It all depends. You have to be an anti-retro joint. Like you gotta be on medication for that. If not, nah. Formula. So just know that in the NCLEX world, when you're preparing a formula, the baby can't finish it, you throw it out. A lot of parents be like, nah, we're gonna refrigerate it a little bit. Be like, nah, you throw it out. According to the NCLEX, according to the book, you're gonna throw it out, you're gonna discard it, be like, nah. Microwave, nah. Common sense. Water, room temperature is key, not warm. Dissolves a lot more better on room temperature. Burp the baby, common sense. Don't add cereal in your joint till with suppression lactation. Support bra, it can take up to 5 to 7 days. Again, like I said before, when you're showering, let the shower drip on the back, not in the front, because you want the water to not stimulate the nippy. Drink water. You're just going to hydrate. Hydrate is key. For siblings, you want to involve them, you know, get them involved, make them feel important or whatever. Postpartum blues, this actually showed up and this is pretty important. Postpartum blues is like, it's normal for sad and stuff like that. Postpartum is basically normal, 7 to 10 days. Now, if mom popped out, though, it becomes like delusional and stuff like that. It's postpartum psychosis. You usually see in the news where it's like mom, baby, because of they can't help it. That don't mean that they're bad people. There's a lot of things going on. There's a lot of changes going on. Mom is stressed, hormones is walling. That just be careful with baby and stuff like that. Now RH is important. If mom is negative, baby is positive, you're going to give program. 72 hours program. And that is basically chapter 15, 16, 17, and 18. This is kind of fun. It made me feel young, like back in the days. But yep, let me know if it's helpful. If it's helpful, cool, let me know. That way, if it is helpful, most likely I'll make another one. If not, at least I can watch it. Peace.